This edition of Tech Talk is brought to you in part by Telex, the interconnection company, owners and operators of 56 Marietta, the most network-rich co-location facility in the Southeast. Tag TV and Tag Radio. Technology now has a voice of innovation and information. Get it on www.tagtvonline.com. An accomplished member of the House Energy and Commerce Committee, past committee member of the Armed Services Committee, Rules, Education and Workforce, Science and Technology Committees, and in the 110th Congress, Phil Gingrey served as ranking member of the Science Subcommittee on Technology and Innovation. Born and raised in Augusta, Georgia, U.S. House of Representatives Congressman Gingrey graduated from Georgia Tech with a Bachelor's of Science degree and returned home to Augusta to attend the Medical College of Georgia. Interned at Grady Hospital in Atlanta and served his residency at the Medical College. For 26 years, Congressman Gingrey built a successful practice in Marietta, Georgia, where he also served in the Marietta School Board, being elected chairman 3 times, and in 1998 was elected to the Georgia State Senate and re-elected in 2000 with over 74% of the vote. In 2002, he was elected U.S. Congressman for Georgia's 11th District. Greetings, everyone. It's Tuesday, May 26, 2009, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. Understanding the broad, sweeping healthcare reform legislation. Just what is the impact and potential of health information technology and Bill H.R. 1087? Will the stimulus bill's $19 billion change the future of health information technology? The Tech Talk continues on the healthcare industry, health information technology, and the future of medicine in the United States, as Tino speaks with doctor, community leader, long-term political statesman, and Georgia's 11th District Congressman Phil Gingrey.
Congressman Gingrey, thank you for joining me on Tech Talk today.
Well, thank you very much. I'm glad to be on the show.
Well, you're certainly a proponent of healthcare and healthcare information technology, so I'd like this to be our focus today, and wanted to ask you a few questions along those lines. So the first thing is there's obviously been an increased awareness and all kinds of discussion. We had a meeting recently with our TAG Health Society, and the topic was the healthcare industry and specifically health information technology. And so I'd like to ask you, from your perspective, what benefits do you see health information technology providing to doctors and the patients, and why do you think it's important to the future of medicine in the U.S.?
Well, I think it's imperative to the future of medicine in the United States if we're going to truly have the best healthcare system in the world. I think we're close right now, but I think that there are some important tweaks in health information technology by virtue of an electronic medical record is one of the most important things we can do to get to that point. President Bush was very focused on this and wanted to achieve fully integrated electronic medical records by the year 2014. President Obama essentially has done the same thing. The National Office of Health Information Technology Coordination was created in the Department of HHS and fully funded. And in the stimulus package, the massive spending bill to try to get this economy going again, with $19 billion was allocated toward health information technology. So I think we're on the right road. I think we can do this in a bipartisan way. I personally, as a practicing physician in Marietta, Georgia, my congressional district, the 11th of Georgia, for 26 years, delivering lots of babies. In practicing medicine, I absolutely feel that this is the single most important thing that we should do to improve access, to improve the quality of care, to save money, but more importantly, to save lives.
Well, that's a good segue into my next question, because one of the things that's on everyone's mind is the cost of health care, and I think people want to be assured that by using, for example, electronic medical records that would fully integrate into the IT system and be connected through all the hospitals and people have it at their fingertips. Do you see that as ultimately helping us to keep the costs in control?
Well, I really do. Now, the RAND Corporation has estimated that the savings could be $160 billion a year. That may be a little high, but but in any regard, if it's $10 billion a year,
right.
And you save a significant number of lives by, as you mentioned, reducing medical errors, and it certainly will be an important step that we should take. I do believe that it will save money because right now doctors are ordering a lot of unnecessary tests. It may well be that a patient goes on vacation and has a spell of illness and goes to an emergency room, and things are done that may have been done 2 months ago at home, back home, and that information not be available to the doctors at the point of service. But if that individual had a identification card, radio frequency ID card, not even as large as a credit card, that could be swiped, that information would be readily available, Spanish, English, whatever. And doctors would know exactly. They would also know that, gosh, maybe I shouldn't put this patient on Coumadin if he or she is already on Plavix,
right.
Because then we could over-anticoagulate and cause a brain hemorrhage and possibly death. So clearly avoiding errors would save money, but as I say earlier, more important than that, save lives. I don't know how much we're talking about in regard to overall savings, but I think we would get much less of this defensive medicine. So, there are any number of ways in which we would save money by having a fully integrated electronic medical record system.
And you're a leader not only for Georgia here, you're also a leader in the U.S. I understand that you have introduced legislation regarding health IT, House Resolution 1087, and I guess the theme is Adopt the Health IT Act of 2009. Can you tell us how that legislation will help in terms of the end goal of fully integrating the health IT system in the U.S.?
Well, I'm glad you asked about that because it's an important piece of legislation. There are maybe 800,000 physicians in the United States, and I would guess that at least 300,000 of them, that's not just a guess, those are pretty accurate statistics, do not have any electronic medical record except for possibly billing or prescribing. And the reason they don't is because it's very, very expensive. And there's sticker shock when you realize that to buy hardware, software, a maintenance program could be as much as $30,000 to $40,000 per physician in a group. And certainly the small groups have a particularly difficult time with that sticker shock. So this bill that you mentioned, 1087, incentivizes them and would allow a group, let's say a larger group that would spend more than that, to deduct up to $250,000 if they had spent that much in the very first year. And that's a significant savings when you consider what the corporate income tax is on net profit. And this would, I think, help go a long way toward getting many of these 300,000 involved in electronic medical records. Now, as we are working on health care reform, both the Democratic plan and the second opinion from the Republicans, of which I have worked very diligently on a task force to develop some alternatives, we want to incentivize those physicians that do utilize electronic medical records by enhancing their reimbursement under Medicare and Medicaid. And then, of course, there's also the stick approach of the carrot and stick. And I think the year is 2015. Beyond that, if physicians have not, despite these incentives that we're giving them, if they have not adopted electronic medical records, then their reimbursement is going to be less. I don't want to emphasize the stick approach, but I hope that doctors will understand that from bills like my 1087, HR 1087, and just what your listeners are hearing today, this will save lives and save money. Doctors will be less likely to be involved in very difficult and expensive litigation over mistakes that are made. They'll sleep better at night, and I think that while there is a learning curve for utilizing the technology, after for maybe 3 or 4 months, that the productivity of the physicians would increase, and I think both they and their patients would be happier.
So the American Recovery and Reinvestment Act, better known as the stimulus bill, you had mentioned earlier, $19 billion was committed to health IT. And I understand that much of that is going to go to incentive payments for healthcare providers. So the Adopt Health Information Tech IT Act, how does that differ in terms of the shared goals?
Well, it's a great question that you ask, and of course, under the stimulus bill, we don't really know. There's no assurance to an individual physician in rural America, particularly, that they'll be in the queue for some of that $19 billion. A lot of it, of course, will end up going to large hospital systems. And, it'll go quickly. $1 billion just doesn't go as far as it used to, does it?
No,
but with this bill that I have introduced, H.R. 1087, everybody would be eligible for this. So there would be no lucky ones and unlucky ones, and no picking winners and losers. So that's how my bill would enhance what the stimulus bill has done.
So you heard it here. House Resolution 1087 is an important resolution, and hopefully our listeners will get on the phones and send the emails and really let the people in D.C. know that they're supporting this. I have time for one last question, Congressman, and it just relates really the broad, sweeping health care reform legislation that's expected to be considered in the coming months. What role can we expect health IT to play? And you talked about bipartisan support, so I think our listeners would be interested in hearing. It's nice to hear bipartisan support. So there's not often we hear that, and you sound like you feel confident that in this case there's something going to happen.
Well, let me be clear, and I know we're running out of time. There is a dearth of bipartisan support on health care reform. HIT is one area in which we can come to an agreement, I think, but clearly there's a wide difference of opinion from what the President and the Democratic majority want to do and what the Republican minority, most of the Republican minority, and certainly many of the physicians, the health care providers across this country have great fear that this providing of a government default insurance plan is just the first step toward a single-payer system where the government takes over everything. And I don't think our consumers, our voters, and our patients want someone from the government standing in the exam room between the doctor and the patient. It's important that we let the free market and give them the tools and the opportunities and the incentives, of course, to try to provide health insurance that's affordable and accessible to all Americans and eliminate the 47 million who are uninsured today. We can agree on those goals, but the way to get there is where the chasm of differences exist.
Well, Congressman, thank you for your time today, and certainly thank you for the work you do for all the people in Georgia and around the country. So best of luck on House Resolution 1087, and thank you again.
I've enjoyed being with you. Thank you.